Coronavirus tests have come back negative for all 189 co-workers of a migrant worker in Taoyuan who recently tested positive for COVID after returning back to Thailand.
But doctors say that anyone in Taiwan who has in contact with a patient within the last 2 weeks should stay on the alert, as the virus can stay undetected for many days. NTU College of Public Health Dean Chang-chuan says that all arrivals at airports should be screened for the virus to make sure asymptomatic carriers aren't going undetected.
After a Thai man who had been working in Taoyuan was diagnosed with COVID-19, all 189 of his factory colleagues were tested for the virus.
根据卫生局王局长刚才的报告
According to the report we just had from Public Health Bureau Director Wang, the latest PCR test results are all negative.
Antibody tests for the factory's migrant workforce are negative, but some doctors say they're not out of the woods yet.
It depends on when they last had contact with the infected patient. If it was over 2 weeks ago, then they're safe. If it was less than 2 weeks ago, then they need to keep on the lookout for 2 weeks.
The source of the man's infection is still unknown, like that of a Japanese woman who was found COVID-19 positive after returning from Taiwan to Japan in late June. In her case, all 123 contacts also tested negative, and no plausible transmission source was identified. That left an unsettling question mark over Taiwan's local transmission-free status. As for imported cases, May and June saw just 9 and 5 such cases come in. But July has seen much more of an onslaught, 20 already, and the month's not over yet.
That reflects how prevalent the virus is outside Taiwan. There are constantly people coming into Taiwan or wanting to come in carrying the virus. So airport border controls are extremely important. Especially at immigration, they should contact universal screening. That's how to catch it in the early stage. We don't want people to find out 14 days later when they leave quarantine and they weren't screened.
Preventing local transmission and catching imported cases are both priorities. Dr. Jen of the NTU College of Public Health has a firm recommendation to screen all arrivals.